Hey everyone, it's Bypass Blake here, and in today's video I want to go over the top 4 most popular weight loss surgeries worldwide. I will explain the surgeries, how they work, how much weight you can expect to lose from each of them during what time frame, and also discuss the recovery time for each surgery. You will have a better understanding of them. That way when you go discuss them with your doctor or surgeon, you'll be able to make a more informed decision. This video is going to be jam-packed with a lot of important information you don't want to miss, so stick around. So when it comes to current weight loss surgery options, you've probably heard of the Gastric Bypass and the Gastric Sleeve. There are actually more than just those two to choose from. However, the bypass and the sleeve are the most popular weight loss surgeries performed worldwide today. Other surgeries I'm going to talk about are the Gastric Band and Duodenal Switch. There are actually a couple more, but they're either rarely performed or outdated, and most surgeons don't really do them anymore. So I will just stick to the popular and most successful ones that are used today. The first weight loss surgery I'm going to talk about is the Gastric Band. The band is a thin, adjustable, inflatable ring they place around the upper part of your stomach to create a new, smaller stomach pouch. The band regulates the flow of food between the upper and lower parts of the stomach so you will feel full sooner, therefore eat less food. It's the least invasive surgery for weight loss on the list, meaning less cutting and surgery time. It is adjustable so the surgeon can customize how the food flows, and adjustments can be performed without surgery. Also, it's removable. The procedure takes about 30 to 60 minutes to complete under general anesthesia. The weight loss of the gastric band is around 40% to 60% of the excess weight over 3 to 4 years after surgery. As far as recovery, most patients go home either the same day or stay one night in the hospital. Most people can start normal activities after a couple of days of being home. Most people take about a week off of work. Patients are usually on liquids or mashed up foods for 2 to 3 weeks after surgery, but by 6 weeks after surgery, most can eat regular foods. It's important to know that the gastric band is being performed less and less when compared to the gastric bypass and the gastric sleeve. More and more surgeons are either not recommending it or performing it due to high revision or failure rates long term. Next surgery on the list is the gastric sleeve surgery, also known as sleeve gastrectomy or vertical gastric sleeve. The gastric sleeve is the newer surgery of the group, but it has had some great success. It's typically performed laparoscopically, meaning inserting a lighted scope with a camera and other tools through 5 or 6 small incisions in your abdomen to perform the surgery. The surgeon removes approximately 80% of the stomach to create a long, narrow sleeve that is similar to the shape of a banana as your new stomach. The new stomach holds about 3 ounces of food initially, which is the size equivalent of a hockey puck. It works by being food restrictive, meaning there's no malabsorption properties. It also changes the metabolism to reduce the hunger and changes in the bile and bacteria in your gut to help lose weight. It doesn't change the way the body processes food and nutrients. However, ghrelin, an appetite-stimulating hormone that is made only in the stomach, which is mostly removed during surgery, is lessened, which reduces the sensation of hunger and helps you eat less and lose weight. This surgery, and also the bypass, have also been shown to change the gut bacterial profile in the colon, and also stomach bile changes from an abnormal, unhealthy fatty pattern to a leaner, lower weight pattern. All you need to know is this means positive changes in the gut, bacteria, and bile aids in helping to lose weight. The gastric sleeve surgery is not reversible in the surgical sense because most of your stomach is removed. However, it is possible to stretch your sleeve pouch stomach over a period of time to a close to normal stomach size, and one could argue that it is similar to a reversal. The sleeve can be revised to a bypass and is actually not all that uncommon. People typically have a revision surgery from a gastric sleeve to a gastric bypass due to severe acid reflux, which is heartburn, or a failure to keep the weight off long term. Side note, it's important to mention that most health insurance plans in the United States only cover 1 weight loss surgery per lifetime, so most revisions or second weight loss surgeries are not covered by most health insurance agencies. That's something to think about, or to call your health insurance agency and ask. So the gastric sleeve surgery is typically better for people who have previous abdominal surgeries, such as intestinal removal or severe intestinal scar tissue, where it would make gastric bypass harder or almost impossible to do. The sleeve is also more beneficial for people who are cigarette smokers because smoking causes ulcers, having a history of severe ulcers, or people who need to take aspirin daily for heart conditions because aspirin causes ulcers. Ulcers are bad for gastric bypass, but less of an issue for people with a sleeve. The surgery takes about 1 to 2 hours to complete under general anesthesia. The weight loss of the sleeve is about 60% to 70% of the excess weight in a 2-year period. As far as recovery from gastric sleeve surgery is surgeon specific, but typically people stay 1 or 2 nights in the hospital. Usually you can go back to work 10 days to 2 weeks after surgery, assuming you won't be doing any heavy lifting. Typically you will have lifting restrictions more than 20 to 30 pounds, and you can't do push-pull motions such as vacuuming for the first 4 to 6 weeks after surgery. Heavy lifting or pushing heavy loads should also be restricted for 3 months after surgery. After surgery, typically week 1 and 2 will be a liquid-only diet. Over the next 3 weeks, you will progress to a pureed food then soft food. After 2 months post-surgery, you will be able to eat regular food. Next on the list is gastric bypass, also called the Roux-en-Y gastric bypass or RNY gastric bypass. It has been around for decades, and it has been dubbed the gold standard for weight loss surgery by the American Society for Metabolic and Bariatric Surgery and also the National Institutes of Health. Like the gastric sleeve, it is also typically performed laparoscopically with 5 or 6 small incisions in the abdomen. Unlike the gastric sleeve surgery though, the bypass surgery is more complex. The sleeve has just 1 step, removing 80% of the stomach. The bypass has 2 steps. First, the surgeon makes a smaller new stomach called a pouch by using and stapling a small part of the upper stomach together. It's about 1 ounce or the size of a golf ball. The rest of the stomach stays intact and stays in your body, so it can produce stomach bile to aid in digestion for the intestines. It's important to note that this makes stomach bile change from an unhealthy, fatty pattern to a leaner, lower weight pattern that helps in losing weight, which is the same metabolic changes that the gastric sleeve surgery has. The second part of the surgery, the surgeon removes a section of the small intestines called the jejunum, and it is then attached to the new small stomach pouch so food will bypass your old stomach and bypass part of the intestines connected to your old stomach called the duodenum. This is important to pass the duodenum because it has sensory hormones that increase hunger and are responsible for fat storage and insulin sensitivity, which all that means is part of this intestine is also responsible for weight gain, and this surgery bypasses that, so none of that weight gain gets triggered whenever you eat. The importance of bypassing the part of your small intestines is so that food, which is calories, doesn't have time to get absorbed. That is called malabsorption. So the amount of food you eat is significantly reduced due to the size of your new stomach, which is about 1 ounce or the size of a golf ball. So vitamins need to be supplemented and are supplemented daily by taking a multivitamin and about 2 or 3 calcium pills or chews throughout the day, which is very similar, if not identical, to the gastric sleeve requirements for a lot of programs. So the new small pouch makes the surgery restrictive, meaning you reduce the amount of food that you can eat, but it also has malabsorption, meaning what you eat from calories aren't fully absorbed, and that will also help you lose weight. There are also the hormonal and metabolic changes mentioned before during the gastric sleeve that help you lose weight as well. The gastric bypass pouch holds 1 ounce of food or size of a golf ball, which is significantly smaller than 3 ounces of the gastric sleeve stomach for comparison. Gastric bypass is typically better for people who have acid reflux, which is heartburn, diabetes, or want to lose more weight than the gastric band or sleeve. It also typically offers a higher percentage of overall long-term weight loss when compared to the gastric band and the gastric sleeve surgery. But less weight loss from the duodenal switch, although the switch is a lot more high risk, which we'll talk about later. Gastric bypass is surgically reversible, however, it is rarely performed and there must be an emergency situation for that to happen, such as severe complications, which is extremely rare. The surgery itself for gastric bypass takes about 1 to 2 hours under general anesthesia. The weight loss is estimated to be 70% to 80% of their excess body weight and is mostly lost within the first 12 to 18 months. As far as recovery, it is surgeon specific, but typically people are usually staying about 1 or 2 nights at the hospital, and typically you can go back to work 10 days to 2 weeks after surgery, assuming you won't be doing any heavy lifting. Typically you'll have lifting restrictions, more than 20 to 30 pounds, or doing push-pull motions such as vacuuming are avoided during the first 4 to 6 weeks of surgery. Heavy lifting or pushing heavy loads should be restricted for 3 months after surgery. After surgery, typically week 1 and 2 will be a liquid-only diet. After next 3 weeks, you'll progress to pureed foods and then soft food, and then after about 2 months post-surgery, you'll be able to eat regular food. It is also important to note that the gastric bypass has a side effect called dumping syndrome, or rapid gastric emptying. That is actually a reason why a lot of people choose the surgery, and it doesn't happen in other surgeries. People that get the gastric bypass use the dumping syndrome as a deterrent to keep them from eating certain foods, such as really sugary sweets or drinks that made them overweight in the first place. The dumping syndrome typically occurs when you overeat something very high in sugar, like candy or ice cream. Just a small bite or two of something really sweet typically doesn't trigger dumping syndrome. It's when you overindulge. What happens in dumping syndrome is the food moves way too fast from your pouch into your intestines, which is the dumping. The dumping syndrome happens in 2 phases. The first phase is within the first 10 to 30 minutes, and the second is within 2 to 3 hours. Symptoms vary person to person, but for both phases can include some nausea, abdominal cramping, fatigue, dizziness, weakness, rapid heartbeat, and sometimes diarrhea. Now, about 85% of people after gastric bypass can experience early dumping at some point, but only 25%, or 1 in 4 people, will ever experience late dumping. Keep in mind, you can avoid dumping syndrome by not eating certain types of very high sugary foods. Triggering dumping syndrome and the intensity of the side effects usually start to lessen, sometimes within the first few months. Dumping syndrome sounds scary, but do not let that deter you from getting gastric bypass. Moving right along to the last surgery in the video, the duodenal switch, also called just the switch, or medically called biliopancreatic diversion with duodenal switch, or BPD-DS. This surgery doesn't just have a complicated name, it is the most complicated of all the bariatric surgeries. The highest risk of all the surgeries, but it also has the highest reward. The switch is very complicated and is only performed by certain surgeons with expertise to perform it, and it is typically reserved for the severely obese with typically a BMI over 40 or 50, with diabetes and other severe medical issues, and even patients that have failed gastric sleeve or gastric bypass. The best way to explain the surgery is the switch is basically a combination of both the gastric sleeve and the gastric bypass surgeries. Like the sleeve and the bypass is typically performed laparoscopically. It's performed in 2 steps. First, completing a gastric sleeve by removing 80% of the stomach and making the same banana-shaped pouch as your new stomach. Then, the surgeon divides the small bowel that normally connects to the old stomach, the duodenum, to create the bypass. The food you eat would normally go from the sleeve into the initial part of the small intestine. However, with a switch, it is rerouted or switched to the lower part of the small intestines, bypassing a significant length of the small intestines so it absorbs less calories but also absorbs less vitamins and nutrients. It is important to note that the switch patients have a significant amount of malabsorption and require significantly more vitamins and minerals supplemented than compared to the gastric sleeve or the gastric bypass. Up to 18% of people that have the switch surgery develop some kind of protein or energy malnutrition. Vitamin requirement for switch patients is recommended by the American Society for Metabolic and Bariatric Surgery is as follows. You have to take extra vitamin A, vitamin D, vitamin K, multivitamin with 200% of the daily values, iron supplement, calcium supplements with 3 to 4 doses daily, vitamin B12 supplements with sometimes injections every month, and drink 3 calcium-rich beverages every day. Lifestyle change and following the supplements is vital for switch patients and is way more important than it is for your sleeve or bypass patients. The operation is performed under general anesthesia and lasts around 2 to 3 hours. The weight loss of the switch patients is about 80 to 90% of the excess weight, and it's lost in the first 2 years post-surgery. As far as recovery for the switch surgery is surgeon specific, but typically people usually stay 2 or 3 nights in the hospital, and typically you go back to work 10 days to 2 weeks after surgery, assuming you won't be doing any heavy lifting. Typically you'll have lifting restrictions, more than 20 to 30 pounds, or doing push-pull motions such as vacuuming are avoided during the first 4 to 6 weeks of surgery. Heavy lifting or pushing heavy loads should be restricted for 3 months after surgery. After surgery, typically week 1 and 2 will be a liquid-only diet. After next 3 weeks, you will progress to pureed foods and then soft food, and then after about 2 months post-surgery, you'll be able to eat regular food. Now that you've been informed and you got all that information, you need to take this information, talk to your healthcare provider, your surgeon, your physician, and have a good conversation about which weight loss surgery is right for you. If you like this video, hit the like button, smash that subscribe button, share, comment, and just jump right into my other videos. Thanks for watching.